Dr. Burke, what is your profession?
I am a doctor certified in forensic pathology. I worked for 25 years as a coroner at Spring County Coroner's Office before retiring. I now teach seminars on forensic pathology and determine the cause of death in individual cases, such as this one.
Did you review the records regarding the autopsy of Jason Johnson?
Yes, I did.
What, if anything, significant did you learn from these records?
First, Mr. Johnson had hypertrophic cardiomyopathy, HCM, a congenital heart defect.
What are the effects of HCM?
HCM causes thickening of the heart muscles in the left ventricle.
Does this thickening change the way the heart works?
It partially blocks blood flow to the aorta, and that obstruction causes the heart to pump harder to overcome the blockage.
What else significant did the medical records reveal?
Jason was scheduled for a septal myotomy to relieve his HCM symptoms in late March.
Why would Jason need this operation?
The severity of the thickening of Jason's heart muscles would have caused a great amount of stress to his heart and blocked blood flow to the aorta, especially if alcohol was consumed.
Could you tell us the most common symptoms of HCM?
The most common symptoms are cardiac arrhythmias, the most common of which is atrial fibrillation,
And what is atrial fibrillation?
a type of abnormal heartbeat.
What effects does atrial fibrillation have?
It can lead to sudden cardiac arrest,
Sudden cardiac arrest.
death.
Dr. Burke, in your professional opinion, is there anything in particular that would likely lead to atrial fibrillation in someone suffering from HCM?
Alcohol intoxication can lead to atrial fibrillation.
Did Mr. Johnson have any alcohol in the system at the time of his death?
At the time of his death, Mr. Johnson had 0.05 blood alcohol content, which is consistent with a 160-pound male consuming 4 drinks 2 hours earlier. Jason was 160 pounds.
Is a 0.05 blood alcohol content usually a dangerous level?
Usually, no, but with a heart condition, the negative effects of alcohol consumption would be high.
What else did he have in his system, if anything?
He also had 40 milligrams of Adderall active in his system from 10 hours earlier, which is within the range for average prescription use and does not suggest amphetamine use.
Did the autopsy of Mr. Johnson reveal anything else?
The autopsy revealed that Jason did indeed have an advanced case of HCM that had most likely been developing since his birth.
Now, what would the consumption of alcohol do to someone with an advanced case of HCM?
Alcohol dehydrates the body and decreases the blood volume that returns to the heart. This can decrease heart function and trigger abnormal electrical impulses. These effects are especially dangerous to people with heart conditions like HCM.
What do you think would have been the adverse effects of the trace amounts of Adderall in his system, if any?
I don't think there would have been any. The amount of Adderall in Mr. Johnson's system was within the range for average prescription use.
So, did the Adderall in Jason's system have any role at all in his death?
None at all. The small amount of Adderall in his system did not cause Mr. Johnson's death.
Dr. Burke, in your professional opinion, what was it that caused the arrhythmia that led to Jason's death?
It is my professional opinion that the alcohol exacerbated Jason's congenital heart problem and led to his sudden cardiac arrest, his death.
Thank you, Dr. Burke. No further questions, Your Honor.
Yes, Your Honor. Can I proceed? Good afternoon, Doctor.
Good afternoon.
When forming scientific conclusions, isn't it important to consider more than one possible explanation?
Yes, it is.
And you're aware that Dr. Ricky Sanchez came to an alternate conclusion about Jason's cause of death, correct?
Yes, but I find mine far more likely.
Is that yes to my question, Doctor?
Yes.
Now, let's compare your experience with Dr. Sanchez. Is that okay?
Mm-hmm.
Is that yes to my question?
Yes.
Dr. Sanchez is Roseau County's chief medical examiner, am I correct?
Yes, he is. She is.
She is.
Sorry. Very
And
sorry.
she's also Roseau County's chief coroner.
Yes.
And as such, Dr. Sanchez was able to directly examine the body on the day Jason Johnson died, correct?
Yes, because she is currently practicing.
And because she could examine the body, she could take blood samples?
Yes, and I reviewed her results.
Doctor, I'm looking for a number. How many blood samples did you take from the body of Jason Johnson?
None.
Objection, Your Honor. Relevance.
Would you like to hear it?
Yes, Your Honor. This goes to show that Dr. Sanchez was the first. This goes to show the lack of credibility of this witness because she was not able to physically examine the body as well as opposed to Dr. Sanchez, who was.
Your Honor, may I be heard?
Yes.
Our Dr. Burke reviewed every record that their own expert witness did take down. So in effect, she is reviewing the exact same information they did, even though she does not have the body directly in front of her. So
I'm going to allow the question. The question is getting to whether or not she had actually worked with the samples as opposed to working with the other doctor's research. So I will allow her to testify.
Yes.
None, but I trust Dr. Sanchez's results to be correct.
Is that a zero, doctor? No blood samples?
Yes.
And you didn't directly measure Jason's BAC, did you?
No.
That was Dr. Sanchez who did that, correct?
Yes, presumably accurately.
And doctor, would it have helped your investigation if you were able to examine the body?
No. I trust Dr. Sanchez, for she has many medical qualifications that would give her accurate results that I could then review, as I have reviewed them.
Now, you're aware that Dr. Sanchez attributes the Adderall in Jason's system to his cause of death, correct?
Yes.
Now, doctor, isn't it true that an amphetamine like Adderall could exacerbate the symptoms of hypertrophic cardiomyopathy?
Yes, but at this level and under these circumstances, the alcohol is the more likely cause of Jason's death.
And you think that because the amount of Adderall in Jason's system was not within a normal toxicity range, correct?
Yes.
And isn't it true that there were 40 milligrams of Adderall in Jason's system?
Yes.
And isn't it also true that the maximum dosage for Adderall at a given time is 30 milligrams?
For therapeutic use, yes.
Yes to my question, doctor?
No. For therapeutic use, its maximum level is 30 milligrams. You could potentially consume up to 60 before it becomes dangerous and lethal.
So the therapeutic dosage at one time is 30 milligrams, correct?
Yes.
So if Jason Johnson were to consume these 40 milligrams all at one time, can that not be harmful to the body?
It could be harmful to the body, yes.
And isn't Adderall a controlled substance?
Yes.
And doesn't that mean you need a doctor's prescription to take it legally?
Yes, you do.
And isn't the point of a prescription to make sure that the person who takes the drug, to make sure it's not harmful to them?
Yes.
And Jason had a prescription for Adderall?
No, he did not. He did not.
So doctor, could taking a controlled substance without a doctor's prescription and having a heart condition like Jason's, could that any way exacerbate the effects of Adderall?
It could, but in this case, my conclusion is that it did not exacerbate the effects to the extent that it caused Jason's death.
Is that yes to my question, doctor? It could exacerbate the effects of hypertrophic cardiomyopathy.
Yes.
Thank you, Your Honor. No further questions.
Organization providers?
Yes, well, near the middle of the month, our clients begin to run out of necessary supplies and food, so we hold a takeout day.
What is a takeout day?
A takeout day is a day that we provide necessary supplies and food to our clients who are in need.
How do you distribute the necessities?
Well, we hand out large baggies containing personal care items and small baggies containing snacks.
Did you ever run low on a supply of plastic bags?
Yes, I actually remember that happening in the middle of March.
How did you address the problem?
I said aloud that we needed more plastic baggies. Sure enough, somebody was so kind enough to bring some in and made the next event a huge success.
Do you know who brought them in?
I'm not sure who brought in the baggies.
Does Ms. Contra volunteer at this organization?
Yes, Ms. Concha does volunteer at our organization.
What kind of work does she do as a volunteer?
She does a lot of things that help our center, such as answering telephones, moving boxes, and sorting through donations.
When did she begin volunteering at Achieve?
She began volunteering sometime last year.
Does she still continue working with Achieve?
Yes, even though she completed her community service hours for school, she still continues to show up every single week.
Objection, non-responsive. Everything after yes be stricken.
I'm going to allow the answer.
Are there any large tasks Ms. Contra performs?
Yes, she consults peers on family and relationship problems and drug and alcohol abuse.
How does Ms. Contra know how to properly counsel her peers?
She knows because I taught her myself of the effects of such abuse.
Was Ray a good peer counselor?
I'd say it's the way she was the most helpful to our organization. She has a way with people, and you can see she really cares about them.
So overall, what type of volunteer is Ray?
I found Ray to be helpful and thoughtful, which are hard qualities to find in young volunteers.
Thank you, Ms. Piper. No further questions, John.
Yes, Your Honor. Your Honor, we would ask, the prosecution would ask for a time check.
Prosecution has 4 minutes and 28 seconds remaining for cross-examination.
Now, Ms. Piper, may I proceed, Your Honor? Now, the 15th of every month is takeout day, correct?
Yes.
And on takeout day, your organization hands out plastic baggies full of personal care items to low-income families.
Yes.
But it's not the defendant's job to get these plastic baggies, is it?
No, anybody is allowed to bring in the baggies, any volunteer that
So that's a
decides.
no to my question. It is not the defendant's job to bring in plastic baggies.
No, it's not her job, she's a volunteer.
Now, the defendant has never helped prepare for takeout day in any way as far as you've seen, correct?
No, she hasn't, but I'm sure if I asked her, she would definitely do so.
So that's a no. She has never helped out in any way with this day.
No, she hasn't.
And you've never seen the defendant bring in these plastic baggies, have you?
I didn't see who brought in the baggies.
So that's a no to my question.
Yes.
But still, you do think that the defendant brought in some large baggies for your center?
I think she brought in the baggies because that's the type of person she is. She's helpful and thoughtful.
So that's a no to my question. You did not see the defendant bring in these baggies.
I didn't see who brought in the baggies.
And the matter of fact is, you wouldn't like to see the defendant go to jail, would you?
I wouldn't like to see anybody go into jail.
But you wouldn't like to see the defendant go to jail, correct?
No.
The defendant's been a volunteer since last year,
Yes.
and the defendant does a lot for your center, right?
She does a lot to help us.
And you took time to personally train her as a peer counselor, correct?
Correct.
Now, a peer counselor is supposed to help their peers deal with drug abuse, right?
Yes.
And you wouldn't like to see the headlines feature a story of how one of your organization's peer
Objection,
counselor...
Honor. Relevance.
Your Honor, this is going to show the bias towards the defendant and how Ms. Piper would not like to see a peer counselor and be a drug dealer and have it displayed publicly.
I'll withdraw the objection, Your Honor.
Would you please repeat your question?
You wouldn't like to see the headlines feature a story of how one of your organization's peer counselors were a drug dealer, would you?
No, we've never had that problem so far.
But you wouldn't like to see that happen, would you?
No, no one would like to see
So
that happen.
that's a no to my question.
Yes, it's a no.
Nothing further, Your Honor.